Steroids promise results for athletes, but there's little proof they deliver any such benefits. For young people, the harm to developing bodies may not show up until years later. We spoke with registered dietitian Jessica Brown at Children's Hospital of Orange County, who tells us why it's such a growing problem for our young people.
Steroids are synthetic hormones that mimic the same effects that testosterone, the natural hormone in your body. Your body starts to increase in the lean tissue. You're starting to build more muscle. Steroid use is a growing problem in adolescents. The reason being is that they're seeing these professional athletes, they're heroes, taking steroids and having good success taking steroids.
What are the adverse health effects when you take steroids?
The Food and Drug Administration is going to control these substances if they have adverse health effects for the public. And then there's a lot of other organizations that will ban these substances in athletes if they show that they actually have an effect on athletes' performances, because they want to make it a fair playing field for these athletes. Steroids actually can be addictive, because once you stop taking your steroids, the muscle mass that athlete built up, it's going to start to diminish. And so if you want to keep that muscle tissue and that strength, you're going to have to continually take those steroids.
Is there an alternative to using steroids, and are those alternatives safe?
Many athletes who may be afraid to use an illegal controlled substance such as steroids might go to your local health food store or supplement store and purchase over-the-counter supplements, protein powders, creatine, or even energy drinks. But these substances aren't regulated from the Food and Drug Administration before entering the market. And so they actually might contain certain banned substances. They might contain anabolic androgenic steroids in those supplements as well. And there's certain ingredients that aren't listed on the label, declared on the label. So the buyer doesn't know what they're actually taking.
Are energy drinks good for athletes?
Energy drinks aren't appropriate for athletes prior to exercise because the carbohydrate concentration is just too high, and it's going to cause cramping, it's going to affect the hydration for the athlete, and so they're not recommended for athletes. It's not an appropriate energy source for athletes prior to exercise.
What's your best advice for an athlete who's taking or planning to take steroids?
I think athletes need to have a foundation of nutrition, basic nutrition, before they start to attempt to, take other supplements or dietary supplements. It's more about the timing of the carbohydrate that's going to give that athlete the best benefit, because that's what provides your muscles energy during an event, is carbohydrate. The best tools for an athlete is carbohydrate and fluid, I think, are the two most important nutrients for athletes.